Okay, Bismillahirrahmanirrahim. This is our part 2 Ospe video, that is surface anatomy, which is commonly asked in the Viva exam is superficial Palmar arch and deep Palmar arch. The most commonly asked question is to first of all the A and B part will be marked on A. If a mark is white, you can see this is the superficial Palmar arch and the lower one is the deep Palmar arch. Either A or B can be used to represent these arches, and they can be asked to name them. Okay, now let's talk about the deep Palmar arch first. Deep Palmar arch is a direct continuation of the radial artery and is completed and it is completed or ends at the deep branch of the ulnar artery. And deep superficial Palmar arch is a direct continuation of the ulnar artery, and it ends at the superficial Palmar branch of the radial artery. Similar is like this. You can see superficial Palmar arch is formed by the starts from the ulnar artery, direct continuation, and completed anastomosis with the superficial branch of the radial artery. Deep Palmar arch is formed by the main contribution here starts from the radial artery and it is completed with the deep branch of the ulnar artery. Another important Viva question is cubital fossa. Here is the cubital fossa. I have made it a diagram, attached a diagram over here so that you can know this is a triangular fossa. It can be asked to you to draw it on the subject, mannequin, or any person, or on your self as well, to mark the cubital fossa and mark the boundaries. Medial border is formed by the pronator teres and lateral border is formed by the brachioradialis, and you can see the contents. Median nerve is present, brachial vein, brachial artery and bicep tendon is present over here, and radial nerve is also present over here. Ulnar artery and ulnar nerve you can see over here on this side. Deep radial nerve is coming to this side. Okay, so this can be asked to you in the Viva question. Let's talk about it. Let's talk about the boundaries. Mark the cubital fossa boundaries on the subject, mannequin, or yourself. Lateral boundary, which I have already told you, brachioradialis. Medial boundary by pronator teres. Base is formed by imaginary line between the humeral epicondyles, and floor is formed by the brachialis plus supinator, and roof is formed by the skin plus fascia plus bicipital aponeurosis. Now let's talk about the extensor retinaculum. It can be asked to you in the Viva to draw the extensor retinaculum and make the boundaries of the extensor retinaculum. And these are the boundaries. Let's talk about the extensor retinaculum. It is present in the wrist. It is a strong fibrous band on the back of the wrist that holds the extensor tendons in place. Here are its boundaries. Proximal attachment, medial side, anterior border of the distal radius. Here you can see anterior border of the distal radius. Okay. Distal attachment on the lateral side, which nerve will be present. Styloid process of the ulna will be present, and in the carpal bones PT will be present. P means pisiform, and tricutrium will be present. A special note is that it is attached obliquely from the lateral margin of the distal radius or radial side to the pisiform and tricutrial bones. Ulnar side, the retinaculum is thicker laterally and forms 6 compartment tunnels for extensor tendons separated by septa attaching to the ridges on the posterior surface of the distal radius and ulna. Sometimes the 6 compartments and the muscles can be asked to you in the Viva exam as well, if the facilitator is very curious to know about your knowledge. Okay, this is the similar question. Mark the flexor retinaculum of the upper limb, boundaries on the subject, mannequin, or yourself. Flexor retinaculum boundaries are medial attachment is PH. PH forms pisiform, bone and hook of hamate, and lateral by CT, crest of trapezium and tubercle of scaphoid, or you can learn TS. Yeah, ST. Lateral attachment ST and PH. On the flexor retinaculum, it is very, very important. Medial attachment, okay, I am telling you over here. Medial attachment is here. PH, pisiform and hook of hamate, and ST, scaphoid and trapezium. Okay, scaphoid and trapezium. Have you learnt now? Okay. Now its importance is that median nerve is present inside, so if there is compression of the median nerve, so it can lead to the carpal tunnel syndrome. The symptoms will be like tingling sensation or the numbness, or there are many symptoms of carpal tunnel syndrome, and it usually occurs in the pregnancy as well, when there is imbalance of the hormones, and there is a hormonal imbalance, so there is electrolyte imbalance as well. So the swelling may lead to the compression of that nerve, that can lead to the carpal tunnel syndrome. Okay, now what is this? Identify this structure. Yes, this is anatomical snuff box. Very good, you have identified it. Anatomical snuff box boundaries are lateral boundaries formed by the abductor pollicis longus, extensor pollicis brevis. Medial boundaries formed by extensor pollicis longus, and floor is formed by the ST, that is scaphoid and trapezius bone, and radial artery is felt over here, which is also its content. Roof is formed by the skin and the superficial fascia containing superficial branch of the radial nerve and cephalic vein, which is also the content. Radial artery lies lateral to the flexor carpi radialis tendon and medial to brachioradialis tendon, palpable at the lateral wrist. Now the axillary artery pulsation can be asked, that is palpable against the lateral wall of the axilla medial to the coracobrachialis. Trace a median nerve in the forearm on the subject, that can also be asked to you. It basically first, when you start from the in the interactive station, if you start telling about the median nerve, first you are going to tell the facilitator that it enters the forearm between the two heads of the pronator teres. It runs between the flexor digitorum superficialis and profundus, and then emerges at wrist and passes through the carpal tunnel. Okay, this is how you are going to answer in such a way, so that the examiner must know that you have a knowledge about it. Okay, whenever a subject is given to you, there are a few protocols for the subject. You asked him, either you are okay, this the thing is very very important, is the thing which is very important, that people ignore this, students ignore this thing, and the common mistakes are that first you do the greeting, or you can say salam to the subject, and ask him if you are feeling any sort of pain. If you see that he or she is an illiterate person, so you can ask her in Urdu कि आपको कोई दर्द है, तो कोई तकलीफ़ हो मेरे एग्ज़ामिनेशन के दौरान, आपका मैं एग्ज़ामिनेशन करना चाहता हूँ मीडियन नर्व का, क्या आपकी तरफ से इजाज़त है? दौरान मुआयना अगर आपको कोई तकलीफ़ हो तो आपने मुझे बताना है। फिर वो आपको बोलेगा आप जी बिल्कुल, आपको मेरी तरफ से इजाज़त है, आप मेरा मुआयना कर सकते हैं। फिर आप जब उसका मुआयना कर लेंगे और आप सारी चीज़ें इंग्लिश में फैसिलिटेटर को बता देंगे, उसके बाद आपने सब्जेक्ट को थैंक यू कहना है। अगर सब्जेक्ट आर्टरी में अगर आप कोई मार्किंग करते हैं सरफेस एनाटमी में या सरफेस मार्किंग में, तो आपने उस मार्किंग को या चौक से जो आप मार्किंग करते हैं उस चौक से इरेज करना आपका काम है। इट्स योर ड्यूटी, इट्स नॉट दैट पर्सन ड्यूटी और द अदर पर्सन और द अदर स्टूडेंट हु इज़ कमिंग ऑन द स्टेशन, it's not his or her responsibility to erase that point. Okay.